Welcome to another episode of the Financial Medicine Show. Omicron has been in the news, and in this episode, Min will give his take on the current events of the COVID-19 pandemic. Stay tuned! Omicron is all over the news these days, and it looks like it's spreading so much and rapidly, much faster than other previous variants. Can you tell us more about this new COVID-19 variant?
Yeah, sure. So Omicron was detected in Botswana and South Africa in November, and the first case was detected in the United States on December 1st. Omicron has more than 50 mutations, 36 of which are in the spike protein that attaches to human cells to cause infection. At the end of November, Delta was the majority of cases. It accounted for 99.5% of cases, but in December, within just 1 week, Omicron became the dominant variant, and it's doubling within about 1.5 to 2 days. When we look at contagiousness of a viral infection, we think about the reproduction number. We think about a number called R naught. And the way to describe R naught is how many people one person can infect. So if the R naught is 5, then one person on average infects 5 people, and then those 5 people, they infect another 5 people. If the R naught is less than 1, then the infection cases is declining. If the R naught is greater than 1, then infection is increasing. And studies have shown that for Omicron, it is 3 times more contagious than Delta. The R naught for Omicron is about 3.47, whereas the R naught for Delta is at 1. And if you had previous infections with COVID, for example, if you had an infection with a previous strain, including Delta or a different strain, then the risk of reinfection with Omicron is about 5.4 times compared to reinfection with Delta.
That's interesting. So it seems like it's spreading really rapidly, but should we be worried? What is the severity of Omicron compared to Delta or previous variants?
Yeah, so far, a lot of the studies have been done in South Africa and in England. In South Africa, they found that there is an 80% lower odds of hospitalizations for Omicron compared to Delta. And in South Africa, what they found was a lot of the patients who are hospitalized, they came in for a different reason, not necessarily related to COVID. They may not have upper respiratory symptoms. They were hospitalized for a different reason, but because everyone was swabbed for COVID, they found that they were positive for Omicron. And so one point of this is that the cases are spreading rapidly through the South African community, but at the same time, the good news is that it is detected incidentally, meaning that Omicron may be asymptomatic or minimally symptomatic in these patients. In Scotland, they found that there was a 2/3 lower risk of hospitalization with Omicron compared to the other variants. Now, the University of Hong Kong did a very interesting study. They took ex vivo cultures of respiratory tract tissue, and they looked at what happened when Omicron infected these lung tissues. And what they found was that Omicron had a predilection towards the bronchus. So remember that you have your trachea going down, that's the windpipe. It branches out to the right and left main stem bronchi, and then it branches out into more bronchioles and then the lung tissue, all the alveoli that helps with gas exchange. So in the Hong Kong study, they found that 24 hours after infection with Omicron, there was a 70-fold increase in viral particles or viral replication in the bronchus, whereas in the lungs itself, there was a tenfold decrease compared to previous wild-type COVID-19. So what does this mean? It means that Omicron appears to favor the bronchus, which a lot of times, if it's 70 times more replication there, then when you're coughing, you're spreading it so rapidly. But at the same time, if there's less replication in the lungs, then there may be less severe symptoms because you're not having fluid filled up in the alveoli, you're not having pneumonia, you're not having acute respiratory distress syndrome compared to the other variants. And for the targeting of Omicron in the bronchus, then you may develop more chest cold or bronchitis type symptoms, which manifest as cough with phlegm, runny nose, sneezing, and so on. So that's a little bit reassuring. But the important thing to note is that It's not just where Omicron targets, it also depends on the immune system of the patient. If you're immunocompromised, you're older, or you have multiple medical conditions, then in that sense, you may have more severe infection than other people. Now, remember here also that in South Africa, when I mentioned earlier that there was an 80% lower risk of hospitalization, they estimated that in South Africa, about 60 to 70% of people in South Africa had infection in the past with a different strain. So they already had natural immunity to that, and that can help protect them a little bit. And also, the South African population is a little bit younger than developed nations or in the United States. They're about 10 years younger. So you're thinking about younger age and history of previous natural infection. That's also another reason why infection rates and the severity of infection is a little bit more mild in the South African population. So that's something that we gotta take into account.
Sure, but I guess in South Africa they had a lot of natural immunity. But what about when we look towards developing nations where there are availability of vaccines and booster shots? And what is the role of that?
That's a great question. So natural immunity we talked about. Let's move over a little bit into vaccines. In the United States currently, 62% of Americans are fully vaccinated. About 73% have one dose. So what does that mean? The remaining 27% are completely unvaccinated. When it comes to booster, the third dose, 30% received the booster, but the frail population or the population that is at high risk, the ones that are greater than 65 years old, 44% of them did not get the booster yet. Now, we know that 2 doses of an mRNA vaccine, Pfizer or Moderna, it provides some protection against Omicron, especially against severe disease, hospitalization, and death. But what the studies have been showing so far is that these vaccines, if you get 2 doses, you don't have adequate neutralizing antibodies for the most part. The Omicron virus or the strain has been shown to have immune escape mechanisms where even though you have some neutralizing antibodies, they're powering through and they're still causing infection. And that's why we're seeing so many breakthrough cases these days for people who get 2 doses, but they're still getting Omicron. Now, boosters appear to help. In laboratory studies that Pfizer have done and also Moderna, they found that getting a booster dose of either Pfizer or Moderna will boost the neutralizing antibody levels up to the level that would be seen with 2 doses against Delta. So one way to explain that is if you get 3 doses, the third dose being a booster dose, then the amount of protection that you would get from the neutralizing antibodies would be the same as if you got 2 doses against Delta, which is a pretty big protection rate. Now, if you get the Pfizer booster, it increases neutralizing antibodies by 25-fold. And if you get the half dose of the Moderna booster, then it increases neutralizing antibodies by about 37-fold. Now, the third booster dose of mRNA reduces symptomatic infection by about 57%, but there's new data coming out that if you do get the booster dose, within about 10 weeks, about 25% of immunity is kind of lost. So that's kind of interesting how we say 2 doses of vaccine, you can wait for 6 months, even though we know that immunity wanes within 6 months. What we're seeing with Omicron is even if we get the booster dose, there is a possibility that immunity wanes by 10 weeks, and we may need more further booster doses with that. Now, remember that even though we say that there's waning immunity, vaccines do help. South Africa, 90% of deaths in the hospitals are those who are unvaccinated or only partially vaccinated. Now, there's one other thing that we want to talk about. It's not just about the neutralizing antibodies. Our immune system also have T cells to help fight off infection. So remember that if you get vaccinated, you develop the neutralizing antibodies, but within a few months, up to 6 months, your antibodies will fall. But that's not the only protection you have. You also have T cells and natural killer cells that gets rid of infected cells. And it also stimulates B cells to produce neutralizing antibodies. And this part of it is not affected whether you get Omicron or not. So even though your neutralizing antibodies do fall over time, you still have this T cell response where, let's say, for example, Omicron is able to evade your immune system and cause infection, and your cells are being infected. Your body will have these T cells that are primed by previous natural infection or vaccination in order to fight and get rid of infected cells. Hopefully, this causes more mild disease. And so the point is, if you had natural immunity or vaccines, you still have some type of defense mechanism, and the T cells are helping to fight Omicron. So that's a little bit more reassuring.
That's great to hear, but one thing I do wonder though sometimes is when we look at Omicron and different COVID like Delta strains, are there any differences, stark differences that we can see to maybe determine if we do have the Omicron variant or just another COVID?
Yeah, it looks like the primary symptoms right now for Omicron is cough, runny nose, nasal congestion, and fatigue. And for the other symptoms like loss of taste and smell that we see with previous strains or wild type COVID, it's less likely with Omicron. And this is kind of similar to the Hong Kong study that we mentioned earlier, where the lung tissue Omicron virus has a preference towards the bronchus, and it's causing more of a bronchitis type symptom instead of pneumonia, fevers, or loss of taste and smell.
That's great to hear because in the early days of COVID, we always heard that a loss of taste or smell was a big indicator for a coronavirus infection.
Mm-hmm.
And
actually, to that point, that's actually something that's very, very difficult to tease apart, because when you have loss of taste and smell, you're really concerned about COVID. But now, during the winter months and common colds, adenoviruses, the flu going around, what is it? If you don't have loss of taste and smell and you only have runny nose, nasal congestion, cough, fatigue, is it the common cold? Is it Omicron? Is it the flu? We kind of don't know.
Allergies.
So that's really hard. Allergies too, yes.
Yeah, it's so hard to tell. So when we think about telling if we have COVID or not, where do the roles of testing and should we even get tested for COVID?
So the number of testing will dramatically increase. It's already increased now, but we know that the incubation period for COVID-19 is around 2 to 14 days. So incubation period meaning the time when you get infected and the time that you manifest symptoms. So 2 to 14 days. But with Omicron spreading so fast, there's a possibility that incubation period might be a lot lower. It might be 3 to 7 days. So if you're traveling, I do recommend getting a PCR test about 1 to 2 days before travel. And then after you get the PCR test, to self-quarantine right away, don't get exposed, and then just wait for the test results to come back. And if it's negative, then you're good to go. Now, if you need a test quickly, then you possibly would make sure that you get a rapid test right before travel. And the reason for that is we know with a PCR test, even though it's 1 to 2 days time period to come back, with the number of testing that's increasing right now, the labs are probably under very high demand. And so it might take a little bit longer for test results to come back, and you're just waiting and waiting and waiting. So consider getting the PCR test, and hopefully it comes back within 1 to 2 days. But if you can't get it back at that time, then get a rapid test right on the day of travel, or if you're visiting someone at high risk, get that rapid test. Hopefully it's negative, and if it's negative, then you're good. Remember that the rapid test is quick, but it has a much lower sensitivity compared to the PCR test. It's about 69% sensitive in picking up COVID-19. It detects the COVID-19 antigen, whereas the PCR test, it has a lot higher sensitivity at 95%, especially if you are symptomatic. And what the PCR test does, it is that it looks at amplification of RNA viral material to see if you have the virus or not. Now, after you're exposed to someone with Omicron, let's say, for example, you know someone in your group or someone in your family or a friend who tested positive for COVID and they have Omicron, what I do recommend is getting tested 5 days after last exposure. And if you develop any symptoms prior to that 5 days, of course, test sooner than that. But we don't want you to test so early that you're asymptomatic, that because the results can come back as a false negative. And if it's false negative, you don't know. I've had patients where they wait the minimum 5 days, they get tested, it's negative, they're happy, but a few days later they develop symptoms, and when we test them again, it becomes positive. So what I'm trying to say is wait at least 5 days. If you have symptoms, test right away. But the longer that you push back testing, then when you get the PCR test, there is a higher likelihood it's going to be a false negative if the test is truly a negative test result.
So what if our test comes back positive and we are infected? Are there any sort of time periods that we should be self-isolating? I know there has been differences from 2 weeks, 7 days, 10 days.
Yeah, so the recommendation currently is if you have COVID-19 infection, to self isolate away from other people for 10 days from the onset of symptoms. And that means that it's an at least 10 days time period from when your symptoms started. And by the 10-day mark, if you have no fevers and you're asymptomatic, then you're considered not contagious anymore and you're clear to go back to society. But many groups, the healthcare field or the airline industries, we have a lot of vaccinated members and workers, and they want the CDC to reduce the self-isolation period a little bit lower because people have to go back to work. There's a very high demand of healthcare workers at this time, right? We're being overburdened at this time. So what I'm trying to say is that it is recommended for 10 days for most groups, but the CDC did change the guidelines for healthcare workers. They actually decreased it to 7 days. So if you're a healthcare worker, you're vaccinated, and you come down with COVID, 7 days after onset of symptoms, you're no longer symptomatic and you have a negative test result, then you can return back to work. So hopefully this will offload some of the demand that we're having in our community and in our society.
Now, looking past vaccines, are there any medications or something that will make us not develop more severe symptoms?
Yeah, so we know that if you are infected with COVID, there is monoclonal antibody treatment, which is an intravenous infusion given to adults and children greater than 12 years old who have mild to moderate symptoms to prevent the progression to severe disease. Just this week, the FDA gave approval for oral medications that you can take by mouth, which is big news, right?
Mm-hmm.
Pfizer came out with a pill called Pavlovid. It is a protease inhibitor that blocks an enzyme that is important for viral replication so that the viral replication will stop. It is approved for adults and children greater than 12 years old and also weigh at least 40 kilograms. And they found that if you take Pavlovid about 3 days within the onset of symptoms, there was an 89% reduction in progression to hospitalization and death. And that's a big thing. Merck also came out with a new oral medication, and it's called molnupiravir. And what this medication does, is that it inserts mutations and copying errors into the genome of the virus, and that causes it to stop the replication of the virus. It's approved right now for adults greater than 18 years old. It's not approved for pregnant women or children due to concerns of bone and cartilage issues. And what they found in the research studies was that there was a 30% reduction in the risk of hospitalization and death if you take this medicine. Now, I want to emphasize that this is only for treatment, not for prevention. If you're exposed to someone with COVID, you should not take these medications. If you have confirmed positive COVID, then you can go ahead and take these oral medications if your physician can prescribe it for you. Pfizer and Merck are preparing shipments to the United States right now, and the quantity is probably not sufficient for everyone. There's so many people infected with Omicron right now. They're trying to send out as much medications as possible. But there's probably going to have some criteria for use for this. They're probably going to reserve it for patients who are at high risk, such as those greater than 65 years old. We know that the age group of greater than 65 years old, 81% of deaths occur in this age group. So they're very high risk. Other high-risk groups include patients with diabetes, others with lung disease such as smokers, COPD, asthma, those who have obesity with a BMI greater than 30, patients with chronic kidney disease, or patients who are immunosuppressed. If they have cancer, they're on chemotherapy, they're on immunosuppressant medications, they have a history of transplant such as solid organ transplant or stem cell transplant, if they have HIV. These are all groups that are at high risk, and so there's a possibility that when the medications come out, it may be prioritized towards these groups, but we'll see when it comes.
Now, looking past that, also, there has been some kind of funny jokes people say. What if everyone gets infected? Should we all just get COVID? Would that produce natural herd immunity and prevent the development of new?
That's probably where we're heading right now, given the high number of cases of infection in people who are fully vaccinated. Now, There's one thing that I want to talk about, which is long COVID symptoms. There is a possibility with Omicron that you might have long COVID symptoms. And what is that? Long COVID symptoms occurs when you get infected with COVID-19. After the infection kind of clears up, you might have lingering symptoms for weeks or months. And people can describe it as headaches, fatigue, brain fog, palpitations, and it can last up to 6 months for that. We don't know right now if Omicron is associated with long COVID symptoms, but we don't know. And it would suck for you to get the infection just to get it, and then you develop lingering symptoms for many, many months. Now, as long as infections are mild, the number of cases are not straining our hospitals and healthcare system, and there's no deaths or very minimal deaths, then infection sweeping through the community will actually get us to herd immunity quicker. And hopefully that will end the pandemic, and it will lead to COVID-19 being more endemic with booster doses every year or 6 months, such as the flu shot.
So I guess for last steps, what should we do? What should each individual take away from this? Should I be getting vaccinated? Should I just get tested? Should I wait for treatments?
Yeah, so there's more information coming out. We don't have all the data, but my recommendation is that if you're unvaccinated, I recommend getting vaccinated. If you are vaccinated, then try to get the booster to boost up your immune system and get that neutralizing antibodies to help prevent symptomatic infection. And even if you get infected, the neutralizing antibodies do help, and the T cells, like I mentioned earlier, do help too. We are going to get big breakthrough cases, even if you're vaccinated, but hopefully it's going to be mild. And if you are symptomatic, get the PCR test because that's the most sensitive, and immediately self-quarantine yourself after you get the test so that you don't spread it to anybody else in case you have it, or you don't get exposed again and having to do a repeat test later on. If you need results quickly, then go ahead and get the rapid test. And again, just continue with mask, hand hygiene, staying 6 feet away from people that you are not sure of their vaccination status, and continue to stay vigilant through this COVID pandemic. Take care of yourself and be safe.
Thanks for helping us make sense of the Omicron variant and a lot about coronavirus and COVID-19 pandemic. If you have any questions or any comments, please let us know down in the comments below. Thank you.
All right, guys. Bye-bye.